So I was attracted to come work there because it's somewhere I can use my paramedic skills, but a different challenge in terms of I can use all my paramedic skills, but in a different environment to emergency blue light care like you would on an ambulance. I've also always been passionate about palliative care, always had a real interest helping those patients at the end of their lives or who've got a terminal illness. Even when I was a student, when I was at university, my dissertation was all based around the paramedic role within a palliative care patient. So in terms of I've used my skills are very much the same as I would in an ambulance, if not, I've still been able to use those emergency skills, just in a slightly different way. But obviously I'm able to respond to those patients acutely that may have a palliative emergency and kind of deliver those emergency skills that I have as a paramedic in those settings. So yeah, an example, actually a really good one, is one of our nurses actually I was talking to quite recently had a really good example of, we sometimes do joint visits, we did a joint visit with herself and one of our paramedics, did a joint visit to a patient that was quite complex, and actually this patient turned out to be really acutely unwell with sepsis, and actually she said although she could manage the sepsis, she wasn't quite sure how to deal with it in terms of transfer to hospital and the emergency side of things. So she found it really helpful actually, while this patient said this paramedic that was there could manage to arrange blue light ambulance, emergency transfer to hospital, managed to pre-alert the hospital, get specialists involved to meet the patient at hospital, which actually she said she wouldn't normally think of that. So that's how, from our emergency side on the ambulances, we've been able to bring that skill across. So I think the biggest challenge I had when I first started this role is obviously I was going to patients, some of them were acutely unwell with infections. As a paramedic, out on ambulance and stuff, I'm very used to going in, assessing a patient, going, yeah, you're poorly with sepsis, let's get you on the truck, let's get you to hospital. Actually, these patients necessarily don't need to go because actually, we're not going to treat this, they're not going to get better. And actually, sometimes they don't want to go. And that's fair enough. So I think one of the biggest challenges I had was actually trying to adapt to actually using alternative pathways and new pathways that actually I may not have used in the past. So I really would love to progress further within the palliative care setting here at Rennie Grey Peace. There's currently the CNS role, so the palliative nurse specialist role, and I know there are plans to hopefully develop that more into a paramedic position within that team. And my plan was hopefully to progress and up into kind of a role like that within Rennie Grey Peace.